I'm going to show you how to retrain somebody's balance in the early stages of rehab. So we always start off by getting the patient into a stable position. So could you bring your hips back so that your hips and knees are at 90 degrees? Oh, I need to lower the bed a little bit here, so you're nice and stable. For a patient with balance problems, they will always try and hold themselves stiff in one position so that they don't lose their balance. They don't like moving about, and I'm going to be starting to get her to move about. So to start off, I'm going to ask you to just slump your body down. Good. And now try and sit up straight. Now don't do it to start with. Oh dear, she can't sit up straight on her own. So I'm going to help her to sit up straight by putting my hands on her chest, and my other hand is at her back, trying to bring her up straight. Well done. Now sit down again, slump down, and now you're going to come and sit up straight, head up. Lovely. Note that I'm not just doing flexion and extension of the spine, it's a more complex movement with pelvic tilt and the movement of the whole spine. Good. And come up again. And my hands are just guiding into slump. Well done. And now sit up straight, and my hand at the back is giving a little bit of assistance to make her sit up straight. And that's really good. Now we're going to start some sideways movements. So when I try and do this with the patient, she might not let me do it because she's frightened she's going to lose her balance. So I'm going to take her to the side. Oh no, she won't let me. Oh dear, that's very stiff. Now you mustn't worry, you're not going to fall. I'm just going to take you to one side. Very good. And then the other side. So I start off gently and I'm going to gradually take her a little bit further. Notice that I'm not doing side flexion, I'm doing a more complex movement. So as I move to the weight bearing side, we get extension of that side of the trunk, and extension to the weight bearing side, flexion to the non-weight bearing side. Very good. Now this is the normal movement of the trunk in balance. Now to try and incorporate it into function, I'm going to get you to reach out. Oops. Your hair's got attached to the to the phone, to the microphone. Right, okay. Now to incorporate a little bit of function, I'm going to get you to reach out over here with this hand. So if you reach, and I'm assisting the movement of the trunk with my hands. So reach out, good. And reach out, and I'm bringing her back again, and down, and now with this hand. You're going to reach out here, and back. And I'm holding the arm and assisting with my hand on the trunk. Very good. Reach out and back. Notice how I give the patient some feedback about whether she's doing it right or not. Okay, now I'm going to get my assistant so that the patient really knows what she's going to have to do. With this hand, I want you to reach for the ball. So reach up and over you go, and I'm assisting and back down. Very good. Now with this hand, reach across. Now if you keep the ball there, and with this hand you're going to reach the ball now, so you're going to rotate a little bit. Very good. And back down. And now this way, you're going to reach across. Very good. And now if the patient stops moving because she's frightened she's going to lose her balance, then I just give a little bit more assistance with my hands like this. So for example, if you stiffen up a little bit, you're going to reach now, reach. Now that's not normal. We need some trunk movement, so I'm going to do some assistance like this as she reaches. So reach out and relax. Good.